afternoon, everyone. It's my pleasure to introduce everyone to our speaker for today for NOAHE Round 8, Session 5. This is the April rounds for NOAHE, and my name is Brian Chan. I'm the Senior Principal Economist at IHE, and I will be facilitating today's session. So before we begin, I'd like to make a land acknowledgement. The Institute of Health Economics acknowledges that it is located in Treaty 6 territory, and this is the traditional and ancestral territory of the Cree, Dene, Saulteaux, Nakota Sioux, and Blackfoot. This territory is also home to the Métis settlements and the Métis Nation of Alberta, regions 2, 3, and 4. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting, whose histories, languages, and cultures continue to influence and enrich our community. We acknowledge the harms and mistakes of the past and the enduring effects of systemic racism. We dedicate ourselves to creating safe and inclusive spaces that strengthen, collaborate, build respectful relationships, and engender change. Today, I'd like to introduce our presenter for today's session. That is Dr. Hugo Francescutti. Dr. Francescutti is currently an emergency physician at the Royal Alexandra Hospital and is also a professor at the School of Public Health at the University of Alberta, where he teaches graduate courses in transformational leadership, advocacy, and public health. Dr. Francescutti was selected as one of Alberta's top 100 physicians of the century by the Alberta Medical Association and College of Physicians and Surgeons of Alberta. And he's also been awarded the Alberta Centennial Medal from the Government of Alberta in 2005. 2011, he was awarded the Queen Elizabeth II Diamond Jubilee Medal, and in 2022, he was awarded the Queen Elizabeth II Platinum Jubilee Medal. Just a few years ago, in 2023, Dr. Liu was honored with the Order of Canada, and from 2010 to 13, he served as the president of the Royal College of Physicians and Surgeons of Canada. And even more, in 2014 and 15, he became the president of the Canadian Medical Association. So a lot more honors that Dr. Francescutti has received over the years. But without further ado, I want to introduce the title of the topic that he'll be presenting on today, and that is Improving Healthcare Access for Alberta's Homeless, the Impact of Bridge Healing and JOAN AI. After his talk today, Kevin Villani, who is the AI Solutions Architect, will be providing a demo of the app or the technology that Dr. Liu will be presenting on today. And I believe we want to save questions till the very end of the presentation or during your talk. What do you prefer?
Oh, during the talk's fine. Yeah.
During the talk is fine.
Yeah, just let us know you have a question and jump right in.
Great, excellent. So just a few notes before we start. All participants will be muted throughout the webinar. If you have any questions, please put it in the Q&A button at the top, and we will be facilitating questions and answers during the presentation, as well as a little bit of time afterwards as well. So with all that said, I would now hand it over to Dr. Liu for your presentation today.
Good. And we're going to share the slides as well, so don't be taking a lot of notes. We'll actually give you a copy of the presentation. I want to get to the end of it as quick as possible so that Kevin can do his demo and then get into some question and answers. What we're looking for today is an opportunity to share the work we've been doing, but more importantly, to gather your expertise in terms of how this AI chatbot can be developed so that it'll be easy to then collect information that could be used to show not only its effectiveness, but also to to learn how to better serve the needs of our patient population. So I already had a hitch. I can't, for some reason, share my screen, but Kevin's going to be sharing his screen. So I will be asking for slides periodically. Next slide. This is just to acknowledge the great work that Hunter Purvis-Davis did in putting the presentation together. Here's our roadmap. The challenges of being unhoused. I'll talk to you a little bit about the patients we see at the Royal Alex in our emergency department on an hourly basis that present with no place to go. When they do show up, that's their desperate cry for help. They're reaching out to us because the rest of the system has failed them and they don't know where else to go, so they end up in our emergency department. I'm going to talk about a program we've been running for the last 2 years called Bridge Healing. You may have heard of it. Very simple concept. Patient shows up in Emerge. You ask them 2 questions. Are you homeless? Do you want a chance to start your life together? If they say yes and they sign a consent sheet and there's a bed available, we only have 36 right now, then they're sent directly from emergency by cab to Bridge Healing and they start their journey to recovery. But the one thing we found over the last 2 years is it works for some patients like really well, and they end up doing incredibly well. They go on to permanent supportive housing, and they don't repeat visits in the emergency department by up to 75, 80%. So for those people, it works really well. But for some people, about 40%, it doesn't. And they come and they spend some time with us, and then they leave, and we really haven't met their needs. So that's why we developed this chatbot called JOAN after one of our first volunteers. And JOAN, you'll see, is a very powerful tool that has a conversation with the patient and gathers information and then comes up with a Corbett score that we're calling, it's a complexity score for these patients because nobody knows how complex they are. And then JOAN will develop a care plan for these patients, book a bed, send them over to Bridge Healing, and then start monitoring their progress as they go through the recovery. And that's where I think you could help us by saying, oh, have you thought of this, or have you thought of that, or have you thought of this? So our emergency departments are chaotic. I'm going to work this evening at 8 o'clock till 4 in the morning. And this is what I'm going to be going to. It doesn't matter who you are, what social status, no matter how healthy or unhealthy, 24/7. We see patients at our emergency department with no appointments. It's a very chaotic environment. Waiting times are now 8 to 12 hours. We have some waiting rooms in our city that have 50 patients. By the time you're finished your shift at 11:30 at night, there's still another 50 to see, another 10 to be seen in beds. So it's just a really chaotic environment. And next slide highlights the homeless, the hungry, and the hopeless that are among them. So that's the patient population we're talking about today. It's the equivalent of the entire population of Banff, Jasper, and Canmore combined. So when you take a look at these populations of these very popular cities and towns in Alberta, that's about 30,000. And that's the number of visits that we have each year in emergency departments across Alberta. 30,000 visits by patients that are unhoused. The next slide shows us an alarming statistic that if you're diagnosed as being homeless, you have a 1 in 5 chance of dying within the next 5 years. That's a remarkable number. Excuse me. I'm nursing a bit of a cold here. And the costs that I just got yesterday, these are costs that were sent to me by Alberta Health yesterday, that over the 5-year period from 2019 or 6-year period to 2024, the estimated costs in the emergency department taking care of patients that are homeless has jumped up from $44 million to $75 million. So you back up before they get to the emergency department. The majority of these men and women have interacted with emergency medical services, police, and fire. And if you add all those costs to these costs, we're talking easily, $100, $125 million a year problem. Next slide. This is a philosophical question, like how did a person become chronically homeless versus episodic homelessness, where someone may just find themselves either in between jobs or they got evicted or got kicked out of a house. What's the relationship between mental health and homelessness? Does substance use disorder come after homelessness or does it come before homelessness? What we do know is that these folks are addicted to chaos. Their life is a turmoil. They go from crisis to crisis. But some of us believe that these first started with adverse childhood experiences. And I've got a medical student reviewing the literature to see the relationship between an increased number of adverse childhood experiences. Those are violence or having a parent who was incarcerated or having a parent that had a substance use issue, having been physically, emotionally, or sexually abused. Those are some of the important things that we need to figure out. And at the end of the day, we want to try and offer an opportunity for people not to end up in a situation like this. So this young 26-year-old that I saw recently in January had his feet looking like that. Those are screen captures, and that's third-degree frostbite. And when I saw him recently in April, the bottom pictures, those were his toes, gangrenous toes that are slowly going to either fall off or have to be amputated off. You can imagine the costs that are associated with something like this. And this happened because this person was homeless. So although the frostbite occurred in January, he's going to be dealing with this for probably the next 7 or 8 months. Next slide. So the Royal Alexandra Hospital in Edmonton is the epicenter. We see 50% of all visits by patients that are experiencing homelessness. And this number is already out to date. We're now the latest figure for 2024 at 9,000 visits. So you can see the next one is the University Hospital, and then the list goes down. So we've got, 1, 2, 3, 4, 5, 6, 7 emergency departments that are seeing patients in the Edmonton zone that are homeless with no place to go. And so what Bridge Healing does is take these patients, and if a bed's available, gets them out of the emergency room and into the safe confines of Bridge Healing. The next slide will kind of highlight that someone that's unhoused is going to have a lot more medical problems than someone that does have housing. This is, we mentioned earlier, substance use, their exposure to violence and therefore injuries. Nutritionally, they're deficient. They don't have the opportunity for adequate hygiene. I just gave you an example of hypothermia, but in the summertime, they just as likely are going to suffer from heat-related illnesses. I gave you the stats that they have higher mortality rates. If you're diagnosed as being homeless, then you have a 1 in 5 chance of dying within the next 5 years. They do have limited access to healthcare because they usually don't have a regular family doctor that they feel comfortable going to. They have their mental health challenges, and these men and women are socially isolated as well. Next slide. So the impact that it has on the emergency department is ginormous. Ties up an enormous amount of resources, ties up beds. It decreases flow through the emergency department. We're not able to offer them the services that they actually need because these patients show up 24/7, and we don't have social workers on 24/7 as well. And so the impact on our healthcare system and our pre-hospital system, EMS, is ginormous. Next slide. So this is the solution. These are purposely built houses. These 3 exist on 100th Avenue and 160th Street, the north side. You've probably driven by them. And rather than build one big building, we didn't. We built 3 separate buildings on 3 separate lots to show that this could go up anywhere within Edmonton. And the main floor is a common gathering area, and the top 2 floors each have 6 units that are self-contained, 225 square feet, where people like this woman, who's one of our clients, will be able to come free of charge, stay for as long as she needs. The building is fully wheelchair accessible, and it's run by Jasper Place Wellness. And it's based on the Eden principle that if you put 12 adults together in a building, what ends up happening is they start forming an instant family and they start taking care of each other. And they do things no different than you and I get together, play cards, have Oilers watch games, we'll have karaoke nights. There's always someone that wants to cook in the kitchen. There's always someone that wants to lead an activity. There's always someone that wants to fix something that's broken. And it gives them a chance to rediscover who they are and set some goals for themselves. And we had a young 26-year-old girl come spend 60 days with us, and now she's a nursing student. We had 3 guys come together. They became such good friends. They moved out into the same apartment building, and nowadays they've formed a friendship. We're incredibly fortunate that the Royal Alexandra Hospital has committed to raising $10 million for bridge healing over the next 3 years so that we can continue to scale up and build new buildings as well. Next slide. So that $10 million campaign will hopefully be able to generate $44 million in not only other dollars raised, but matching capital. So the city of Edmonton has stepped up to give us free land and also a startup grant. So we've got probably 4 more new buildings going up this year, 2 for sure. And we'll probably need about 200 to meet the needs of all the patients that we're seeing. Qualico held a golf tournament last September that was incredibly successful. The next slide shows you the check they gave us for $180,000. And they're going to redo that golf tournament May 28th this year. So we're getting great support from the community. The Globe and Mail did a fantastic article back in April of last year that highlighted how emergency departments across the country are getting slammed with patients that are presenting that are homeless. The number is getting worse year after year. So the benefits are obvious economically for the individual themselves, but for the system as well. And what we want to do is continue to build on that and now start measuring how we can get even better meeting the healthcare needs of our patients. Next slide. So the cost savings from various studies and from our own are quite large. So we know in our 2 years experience that our patients that are successful have about a 70% reduction in return visits. The Alberta Medical Association did a brief economic analysis that folks at the Institute had a chance to review and provide some suggestions, but that preliminarily shows that there is cost savings. It needs to be a little more refined, but that's why hopefully by the end of this conversation today, we'll leave plenty of time for you to get involved and say, well, have you thought of this? Or are you measuring that? Or for Kevin, it'll be crucially important to talk to experts like you and find out exactly what fields he needs to capture so that we can go back and show how cost effective this program is. Next slide. So how do we then take the chaos of having 5 different emergency departments, 6 potentially if we add Sturgeon, sending patients 24/7 to the limited number of beds that are available at Bridge Healing? And if we continue to build like we plan, and let's say in the next 5 years we have 100 buildings, that's 1,200 beds. So how do you take 6 emergency departments, 24/7, wanting to send patients, and as we start increasing the level of service for Bridge Healing, how does a social worker try and figure out exactly what bed to send the patient to? It's impossible. And that's why Kevin's been working hard on developing JOAN. So, Kevin, maybe what I'll do is I'll just let you talk briefly on JOAN. We're going to skip over the technical slides, and then we'll get to the point where we can take a few questions, and then we'll do a JOAN demo. Okay?
Absolutely, sounds great. So basically, you can think of a JOAN as a tool that is going to keep a track of every single bed that's available all across the city. Primarily, it will be focusing on the bridge healing, but it could be extended to the any facilities or the organization. And you can think of a JOAN as an AI chatbot that is available 24/7 that's going to talk with the patients in the emergency department. It will the JOAN, the chatbot would know basically, which bed is available where. And after talking with the patient, JOAN can figure out how complex this patient is. So basically, the JOAN can figure out if they should be sent to the Bridge Healing on 100th Avenue, it should be sent to the, Woodside Millhood's facility, or it could be downtown. So basically, based on the complexity of the patient, Joan can figure out where the bed is available, where the resources the patient would need is available, and it can also speak in multiple languages. So sometimes what happens is that there are barriers to the languages. Like humans cannot speak, let's say, for example, Somali, or they cannot speak, let's say, French, for example, sometimes, right? That's when Joan, as a chatbot, can speak any language. It can speak in probably 24/7, and in future we are also planning to include indigenous languages. So most spoken languages, indigenous languages, we hope that it would be Joan can speak in that languages as well. And basically, it's like an intake process. It does a whole bunch of figuring out. It's like an Airbnb, let's say, for the people who are experiencing homelessness. And it's a management tool that's going to keep a track of all the data, and it can, at the end, it could generate reports which can give us probably a very insightful insights to the all the data.
That's good. And then the next slides are just the technical stuff for those of you that are interested in that. But remember, we'll send you these slides. And then we're going to get to the end where it's a series of questions of what you can do to help us out. So here's the help that we need. Anonymized healthcare data to support in its training. Nate is helping us do some final training, and then we're going to be do training with end users, people with lived experience. The regional language, it looks like we're under control there. Server space and cloud resources. Next slide, I'll show you some more. Sharing AI and NLP expertise, donating relevant data sets, participating in pilot testing. Even if you guys want to take Joan and play with it and see if it works from your perspective, and look for things that are not in there that need to be added. Technical infrastructure, spreading the word, and then the biggest one is contributing to ethical development. We had an ethicist take a look at what we're doing, and we're trying to be as trauma informed as possible, but you can never get enough opinions as to are we on the right track. So some of these are some of the things that you could be involved in. And I just want to take a second and share this testimonial, and then Kevin will give us a demo, and that should leave us pretty well half an hour for discussion back and forth, okay, or answering any questions about anything we've said so far. So this is that young person who I mentioned stayed with us for a while. And this is a totally unsolicited note from her. When I came here from the Royal Alexandra Hospital in December, all my life belongings had been stolen. My wig was falling off, laugh out loud. All I wanted was a shower, and I had no faith in the future. I still remember Joseph and Odessa, these are people that work at Jasper Place Wellness, welcoming me into the program, and how skeptical I was that evening, thinking to myself that nothing and no one was going to save me. But I made a bet with myself to give this program a chance for just 1 week at a time. And thanks to you all, I finally have ID. I have my own place to live for the first time in my life, and don't have to beg family or be in a relationship for a roof over my head. And I got the financial support to be able to reapply to college. I'm going to be at NATE in September. You have all saved my life. I will never forget any of you. The light sleeper in B5, laugh out loud. So, I mean, at the end of the day, sure, it'll save money for the healthcare system, but at the end of the day, the most important thing is that I think it saved this young woman's life. So the next slide is a QR code that you can scan. It'll take you to the Royal Alexandra Hospital Foundation, and there you can find out more about their campaign. And that's my phone number. If you want to reach out directly, you can just give me a call. And as I said, we'll share this with the conference organizers so that you can have access to the slides. You don't have to worry about it. You can use the slide deck if you want to share the story of Bridge Healing and the AI chatbot with others. And now what we'll do is while Kevin gets set up to doing the demo, we'll take any questions that you might have so far. And feel free to turn on your camera if you want. I always hate looking at abbreviations, but I forced one guy to put his camera on and he had just stepped out of the shower. So I'm not going to force anyone to do anything, but it's always nice to see a face if you want.
So thank you for the presentation so far. We really look forward to seeing the demo in a few minutes. In the meantime, we have a few minutes for any questions that people may have. And I'm just going to open the Q&A and chat areas to monitor that. So if there are any questions, please feel free to enter there. And while we wait, I do have a question about the program itself. So there was mention that JOAN does it helps support figuring out which beds would be appropriate for the individual by gathering information. So does that mean that the different buildings are set up for people with different complexities, or within each unit there are floors or rooms that have different complexities? How is it sort of
Yeah,
how are they
right
sort of
Yeah, no, right now it's pretty generic. Everyone goes to any of the beds, but in the future, what we're discovering is that some people have higher needs. And so we will probably have some buildings or floors that are designated for higher medical attention or a greater mental health support. And to be able to meet the needs of the patient. It's unrealistic to think that every patient that comes to us has exactly the same needs. And so what we're discovering is that some will have higher needs, and we want to make absolutely sure that we don't like fill one building totally full with people with super high needs, because that would be a really chaotic environment, but that we figure out the best way. Is it because we're going to mix the caseload, or is it better to have one building that has higher acuity? We don't have the answer to that, but Joan's going to help us figure that out.
Fantastic. And Kevin, do let us know when you're ready to go. You're on.
Yep, I'm ready. I'm just going to share my
you're ready?
screen.
Okay.
Yep.
Okay. I'll pass it over to you.
Yep. Perfect. Let me know if you're able to see the screen.
Yep.
Okay, so basically there are two iPads here. We can imagine one iPad at the emergency department and one iPad at the breach healing staff. So one iPad is being held by breach healing staff members. It's like, somebody walks up to the reception area. That's where the one iPad on the right side, that's where it would be staying. And on the left side, it's basically at the emergency room where the patient would be able to talk with the iPad and figure out which bed is available. So let me just go with the demo and see how this would look like. Okay, so I'm going to start a demo. Hello. Hello.
Hello, I'm Joan. I'm here to support you in a caring and non-judgmental way. You can stop chatting whenever you like. I'm just here to help you as best as I can. Bridge Healing is a short-term supportive place to stay for people leaving the hospital with no stable home. If you're comfortable, let's talk about your situation. What is your name?
Sure, my name is Kevin.
Thank you, Kevin. It's nice to meet you. Can you tell me where you were staying before you came to the hospital? This will help me understand your current situation a bit better.
Well, I did not have any proper place, so I was living on the streets. Sometimes it's really very hard to stay on the streets. So I would just end up at the Royal Alex Hospital Foundation, Royal Alex Emergency Department. But I did not have any proper place. I'm just sleeping on the street these days.
I'm so sorry to hear that, Kevin. That sounds incredibly tough. Thank you for sharing that with me. Do you have any income at the moment? Knowing this will help us understand how we can best assist you.
Well, I don't have any income at the moment. I had a job momentarily, but I lost the job and I'm getting some form of the income in form of employment insurance. So I just have EI support right now, but that's all I have.
Thank you for letting me know, Kevin. It's helpful to understand your current...
Can you please ask me this question in Japanese?
申し訳ありませんが、特定の言語で質問することはできません。So, Kevin, you mentioned you're receiving employment insurance support. That information is helpful.
Can you ask me this question in South Korean?
Of course. 당신의 현재 상황을 더 잘 이해하기 위해 수입에 대해 여쭤봐도 될까요?
Okay, let's switch back to English.
Absolutely, Kevin. We'll continue in English. Now, do you have any medical, mental health, or substance use concerns that might keep you from doing daily tasks, like attending appointments or filling out paperwork?
Nope, I don't have any substance use issue, but I do drugs and I sometimes I drink, so maybe that could stop me. But I just do it for few days when I'm feeling depressed and I'm in anxiety. Uh, that's when I do it. But most of the times I'm pretty comfortable doing the daily tasks.
Thank you for being open with me, Kevin. It sounds like you're going through a lot. And it's understandable to seek relief during tough times. It's good to hear you feel comfortable handling most daily tasks, as this will be important for the transition to stable housing. Are you able and willing to spend this transitional period focusing on finding permanent housing? Bridge Healing is designed to support that journey.
Yes, I'm willing to make commitment, although I need some help from your staff members to stay focused. But I'm very much happy to make commitments to find housing.
That's wonderful to hear, Kevin. It's perfectly okay to need support, and our staff will be there to assist you in staying focused on your goals. One last question. What is the most important thing you need right now? We want to understand your immediate needs to provide the best support possible.
I need to find bed as soon as possible. I need a bed, so please book me a bed. Thank you.
I've reserved a bed for you, Kevin. You can head to the Main Street shelter, located at 123 Main Street. Your room number is 12A, and your booking ID is 23. Please mention this number when you arrive at Bridge Healing. The
Thank
team
you
there.
so much.
You're very welcome, Kevin. If you need any further assistance or have any questions, please don't hesitate.
So that was the first part of it. You can see that the chatbot was able to communicate with the patient in multiple languages, and it was able to find a bed. So on the right hand side of the tablet, the iPad at the right hand side, it's like breach healing staff members knows that someone is expected to be coming in at the breach healing facility. And basically, if I dismiss this, and if you look at all of these people over here, someone somewhere they have filled up the form, and they should be expecting within few time. They will also be assigned the bed number. So like let's say Tom has been assigned B1, and he's coming from University of Alberta Hospital, and his Corbett score, the complexity score, is 74. So this score is very important because it would make things very much easier for all the people to understand how complex this patient is, and we are developing this with the help of University of Alberta. And obviously, Dr. Lu can talk more about this later on. If we look at the assessment of the Tom, AI chatbot would be able to generate whole bunch of assessment based on the conversation happened. It can figure out if the patient was on tobacco, or if the patient has domestic violence issues, and so many other things that the chatbot can figure out. And based on that, it was able to assign the bed. It was able to book a bed for the patient. Obviously, when the staff members look at this assessment, and if they feel something is not right, they can always edit assessment and retrain the AI. So in future, it is able to predict properly when this patient, what kind of resources the patient would need. One of the very important thing that AI chatbot does is predicting how much days the patient would stay at the breach healing. So right now it predicts that it will stay for 23 days. And another thing that AI chatbot does right now is able to generate the whole care plan for the patient. So let's say if you click on create a care plan, it is able to generate all the things that the patient should be cared with, so that their stay at the breach healing is success. So we can see that it is able to generate the identification document that the person would need. the medications and dietary needs the patient would have been taken care of, the substance use, provide smoking and all of those resources to reduce the strategies. Like we cannot just say that don't do smoking or anything. So it will offer step-by-step guide uh, to how to improve the patient's health overall. So all of these things is being generated. We can just print this off and stick it at the Bridge Healing's room. And obviously there would be the assessment timeline, and obviously this RMS system, resource management system, is able to track in real time which bed is available and which bed is taken. So the green rooms are currently available, and the red ones are currently being occupied by the patient.
So, in the interest of allowing the audience to ask questions, the back end, the RMS part of JOAN is fantastic because it allows Jasper Place Wellness to manage all these different buildings in real time. Maintenance that's required for them. It can generate reports. It can predict, as Kevin says, which beds will be available when, so that we can use that in our emergency department. Because right now the biggest problem we have is there's no beds ever available because they're always filled up. And the beds run at about 103% capacity. So in other words, if someone is discharged in the morning, by afternoon, that bed's filled. So there's 2 people that actually stayed in that bed that day. And before, there was no way that we can keep track of all this. So Kevin single-handedly has developed this, and it's developing at a rapid pace. But we're still at the stage where we can take input, your input, and incorporate that with not only questions, but in the back end to be able to measure, so that if a health economist comes along and says, this is the information I need to do an analysis of what your program is, Kevin should be able to run that program for you. So there should be a button that says economic analysis of Bridge Healing from this period to this period. I mean, I don't know anything about that. Kevin doesn't. You do. So if you can think of a way to take Kevin aside and say, hey, Kevin, I'd like to have an hour with you, and these are the things that I think you need to put in there. And as a matter of fact, if the Institute of Health Economics wants to be our partner, just like all the other people that are partnering with us, we'd love to partner with you and use this as a tool. Because if this tool goes province-wide, which we suspect it will, it'll then go Canada-wide. So this will be an opportunity for some really good analysis that's never been available before, right? At least we don't think it's ever been available before. So that still leaves a full 20 minutes for Brian, you to lead conversation if there's real people behind these initials.
No, they're not AI. They're actually real people. I can verify those names, and I've talked to them before. But we do have a few questions, and I'll get straight to it. So Dad was the first one to ask. Well, he started by saying, thank you for your presentation. Can I ask if a PWH without medical need could use the home without going to the ED? So say somebody who just needs a place to stay for 30 days.
What's a PWH? Is that a
person without home, I think?
Yeah, no. The answer is no. They've got to come to the emergency department because it's been designed to offload pressure within emergency. If we had 300 buildings, then I think people should be able to just walk up and interact with Joan at the door, right? Or we should be able with an iPad to go from encampment to encampment and see if we can recruit patients from there. But for now, we have to accept them from emergency because that's the goal, is to try and improve flow through the emergency department. But you're absolutely right. There's no reason that paramedics or police officers couldn't have this iPad with them and do the intake right when they interact with someone, and avoid emergency completely. Mm-hmm. There was a thing there about if somebody doesn't know English, command to switch language. Kevin, I think somebody that doesn't know English can just start off the conversation, eh?
Yeah, they can just start off in Japanese, for example, or Hindi or Korean, and chatbot would automatically pick and start speaking with it in that language without they speaking in English or asking them to switch language in English.
Yeah. Okay.
Excellent. We have another question here from Rachel, and she is wondering, what kind of engagement have you conducted about using JOAN chatbot to place your patients? Has the system been well received by participants?
Oh, yeah. So the answer to that is yes. And it keeps getting better all the time. Because when we first started, we went to Niganan Housing. It's Indigenous housing just off the Yellowhead and Fort Road. And they helped us, start this process to make sure that it was trauma informed. And as I mentioned, Nate has an entire division that is going to take the software and test it. So they're going to test it with their staff, they're going to test it with students, and then they're going to test it with focus audiences of folks with lived experience. So the literature is quite, robust that patients trust computers far more than they trust healthcare providers. And so there's no problem with patients interacting with it. And Kevin's got an accent, and Joan's able to, listen to his accent, and it's not an impediment. And Kevin one day showed me having Joan actually talk with different accents as well. So it's pretty remarkable the number of languages that she speaks.
Very fascinating, very interesting. And I guess just a follow-up. I also encourage people to keep your questions coming in the Q&A section. And while we wait, a follow-up to the first question in terms of the setup of individuals getting access to shelter. So have you been in contact with groups, individuals who would have first contact with individuals who are homeless and could benefit from these services, and so they can sort of direct people to the emergency so that they have an opportunity to receive bridge healing, or has it only been confined to, I guess, hospitals?
Yeah, that's a good question. We're not looking for patients simply because we don't have enough beds, right? And so we're struggling just to meet the demands of our emergency department. When probably in 3-4 years we have enough capacity, then we can start looking for other places for patients to come into the system. But right now we're just struggling to meet the demands of the patients that we're trying to serve in emergency. So the trouble, we don't ask patients if they're interested in the program unless there's a bed, because there's no sense in asking a person to get all excited about something and then saying, oh, there's no beds, right? So we will only right now interact with a patient once we confirm that a bed is available. And as I mentioned, they rarely become available, right?
Yeah, right. So
that's why we have to scale up. That's why we have to build more buildings.
Yeah, I can imagine you probably have to refuse a lot of people who could benefit from the program, given the capacity. How long does an individual usually stay in the program?
It varies. Usually about 60 days is average. Some have stayed for 8 months. A gentleman who was intellectually disabled and needed a certain group home, and it took that long to find it. Yeah. So Brian, in the last 15 minutes, if people can if they don't want to ask a question, that's fine. But if they can just put in the question and answers some fields that they think are important to capture so that we can do this economic analysis.
Yes, we definitely encourage that. So if you have any ideas of fields that would be important to include in an analysis and an economic evaluation, the team here would be very much appreciated. Any help that you can provide. Like we can probably, there's the obvious ones, such as the cost of ER visits itself. And I guess one other question would be how how much shorter, I guess, the stay would be in the ER for somebody requiring or going through the process with bridge healing as well. Like, how long does that process take before they're discharged versus not would be important as well, I would think. Encourage others to chime in of other areas that would be of importance.
Boy, this is a true data guru conference. You don't see any faces and there's no questions, you know.
Well, it was a great presentation. It was everyone. I mean, it was very clear what the need and what needs are addressed with the program. Like,
great. Well, you know what we'll do then? We'll share the presentation and sign off and give people an extra 10 minutes to enjoy their lunch.
And definitely, they would have your contact as well, so they could definitely contact you afterwards and provide a list of variables that would be of interest. I'm sure there are a lot to share, and I mean, it touches all different aspects of the healthcare system and beyond as well. So there's definitely some input that will be provided, I'm sure.
Kevin, did you want to make any last comments in terms of what would be helpful for these folks to share with you?
Well, obviously, on the AI side, I think we don't have any centralized access to the data in this field, like in the field of people experiencing homelessness. Like, I don't have particular data set that says that, hey, this is the assessment that we didn't pass, and if we did this kind of things to improve the overall patient health. So if there is any way or any data set or any surveys or be it anything that you think could be helpful, please do send it over. That it's, even though you think that it may or may not be related, it's always very helpful to look at all the data.
For sure. And I just got another question that just came up. So Tucker was curious how JOAN derives the patient complexity scores. So what measure does it use, and is there a way to validate the accuracy of those scores?
Right now, it is kind of being developed by University of Alberta students, but basically it looks at a bunch of data that is manually created by the experts in the field. One of them could be the staff members who are actively interacting with the people who are experiencing homelessness. So what we did is created a custom data set and validated it through the bridge healing staff members. Right now, it is just about 20,000 rows, but in future, we think that the accuracy would keep increasing as we add in more and more data, and the staff members keep validating it, and it says that, hey, you did this wrong, you did this right, and it will keep retraining the AI model.
Yeah, and the other thing, Brian, is that the Faculty of Rehabilitation Medicine has got a student that's doing a literature search and will be helping us develop from sort of a rigorous academic side the Corbett score as well. So it's no one has ever developed a complexity score for homeless patients. So this will be the first time that it's being developed. So we're working with the Faculty of Rehabilitation Medicine as well. And then there was a question from Deborah on the sustainability of this platform. We received a very generous donation from a donor to make sure that JOAN is as robust as possible. And so we're well funded to make sure that we get to that point. And then we've got a big meeting tomorrow with Alberta Health. I suspect at some point the government will step in and say, wow, this is a tool that we can use in a variety of different ministries, and will, step up and provide the continuing operating funds. But we've got enough funding for the next 3-4 years to keep JOAN going.
Excellent. And I think Helen also made a comment in the chat that obviously one of the components for an economic analysis would be the costing side of how much it costs to build up and maintain the program as well.
Yep.
And another comment here from Sasha, who was happy to meet up with you afterwards to discuss what might what they might be able to give you more of what you're looking for, which is the fields. Difficult to provide a list right away, but he's happy to follow up with you on that.
Okay. Okay.
That's
well,
great.
listen. Yeah, Kevin, thank you. And Brian and Elaine, thank you very much for the invitation. And what we'll do is send you the PowerPoint that you can share with others. And thanks, Mackie, for your reaching out after that initial conference in Calgary and starting the process. But we'd love to have the Institute be actively involved as we move forward with this. We could sure use your help. Yeah.
And thank you for presenting today. And thank everyone for attending online. Just a quick announcement that our next seminar will be presented by Tim Zhang, who will be presenting next month in May. And the topic of his seminar is Physician Financial Incentives and Dialysis Modality Choices, Evidence from Fee Schedule Change in Alberta, Canada. So that should be very, very interesting. Please visit our website, noah.ca, to register for any of the upcoming sessions and subscribe to our mailing list to get any updates on NOAA events and opportunities. So again, I'd like to thank our two speakers today on this very wonderful talk and learning more about this amazing project that they are working on. And thank you everyone for attending, and hope you have a great rest of your day.